A new report released this week shows that India has the highest number of newborns dying on their first day of life. The report reveals that 309,000 children die within 24 hours of their birth in India every year. The main causes of death are severe infections, low birth weights, and asphyxia. Access to quality healthcare is also a critical challenge for thousands of mothers across the country. Hasina lives in a slum in North Delhi. She gave birth to her child at home, but took him to hospital after realising he was unwell. She said she was turned away from the hospital because they were already overwhelmed with other patients. Her child died on the way to a second hospital.
He was weak, but the doctor never told us anything. When we took him to the second hospital, they came back an hour later and said that if we had brought him in half an hour earlier, he could have been saved.
Save the Children, who published the report, state that the first hours, days and weeks of a child's life are its most critical. The report adds that 43% of the 7 million children under the age of 5 that die worldwide every year are under 1 month old. Amma also lives in North Delhi. She explained how hard it was for her to get medical help when she went into labour in the middle of the night.
Someone had told me I should call the emergency services. My neighbour said it would cost 1200 rupees. I didn't have that much money. The labour pain started around 9 p.m. All night I stayed at home in pain. Then I couldn't bear the pain anymore, and I decided that I didn't want to give birth at home and I should go to the hospital. My neighbour said, "It's your wish, go." By the time I reached the hospital, it was 2 a.m. When we reached, we couldn't find anybody. We had to wake up the gate men, but they wouldn't wake up.
Dr. Veena Devan provides healthcare to mothers and babies like Amma and her son out of this health van. She said poor sanitation in these areas leaves newborn babies vulnerable to life-threatening illnesses.
India, usually these people face diarrhea and pneumonia. Diarrhea because these people don't have proper water and the child doesn't get proper food. Then the child meets diarrhea. Due to diarrhea, the child may die sometime. And the other cause is pneumonia, due to which the child dies.
The report states that addressing education and women's empowerment issues in India would have a huge impact on reducing infant mortality. Educated and empowered women are more likely to delay marriage, space pregnancies apart, and access healthcare. Dr. Maruti Sinha, senior consultant obstetrician and gynecologist at a government hospital in Delhi, said babies have a good chance of survival if the mother gives birth in a hospital.
Hospitals, they have a very good chance because, we have round-the-clock emergency on-call doctors, and the facilities here, mostly in most of the city hospitals, not alone in Delhi, Bombay, but most of the city hospitals, they are very well equipped, and the doctors are well trained, so they have a very good chance if they reach the hospital and the deliveries are done in the hospitals.
This government hospital in central Delhi may not look pretty, but it does at least provide the round-the-clock care that a mother and child may need during those critical hours and days around the birth. Carolyn Miles, President and CEO of Save the Children, explained some of the inexpensive solutions that could bring down the numbers of newborn deaths by as much as 75%.
There are actually 4 very key interventions that are very inexpensive. They're between 35 cents and $6. They are things like chlorhexidine for cord care, they're antibiotics for infections, they are making sure that the child obviously has the prenatal care that they want and that they need. So those are the things that really have to happen, just a few of the things that have to happen. And it's really about getting the care closer to where children are dying.
Findings from this report are likely to result in an increased push from stakeholders to improve healthcare quality and access within the first days and weeks of a child's life. In recent months, the Ministry for Health in India has made commitments to put more funds into training community health workers in districts with the highest newborn mortality rates.